Greetings from ASCO. My name is Dr. Breelyn Wilky, and I'm a medical oncologist and sarcoma clinical researcher at the Sylvester Comprehensive Cancer Center at the University of Miami. I'm here today to talk with you about what I think are the most exciting trials that were presented at this year's ASCO in the sarcoma track. The first study that I would like to share with you was actually a plenary session. So it's not very common that we have trials for sarcoma in the plenary, but this was a study presented by the European Pediatric Sarcoma Group. And this study was looking at patients with rhabdomyosarcoma, specifically children under the age of 21 who had been diagnosed with high-risk rhabdomyosarcoma. So the study basically was looking at whether combination of standard chemotherapy with a maintenance protocol to follow the standard chemotherapy with the drugs vinorelbine as well as Cytoxan could improve outcomes for these kids with high-risk rhabdomyosarcoma. And so the study randomized patients to receive either 6 months of vinorelbine and Cytoxan or just being monitored after standard treatment protocols. The results were positive. This is the first positive rhabdomyosarcoma study in at least 20 years, and maybe only the third positive one in the last 40 years. So what it showed was that patients did have an improved overall survival with the maintenance therapy. So the issue is this ready for prime time, especially here in the United States? Because again, this study was done in Europe. The issue is that the Children's Oncology Group, which has the standard chemotherapy protocols for rhabdomyosarcoma, is slightly different than the European guidelines. And importantly, our protocols in the United States go a little bit longer and have different drugs. And so the take home is that following the European protocols, adding maintenance chemotherapy with vinorelbine and Cytoxan is going to likely be the new standard of care. However, we're not quite ready in the United States to adopt maintenance therapy simply because it may be that just the longer duration of chemotherapy or our alternate protocols are just as beneficial. So that's the rhabdomyosarcoma plenary session. The next study that I want to highlight came out of Memorial Sloan Kettering and the Alliance Group. And so this was a study of sorafenib for desmoidfibromatosis tumors. So desmoid tumors are not technically sarcomas. They're also not technically cancer. However, they are locally aggressive, problematic tumors that until recently really have had few standard treatment options and no approved therapies. So this was a study, a randomized phase 3 trial that randomized desmoid patients 2-to-1 to either sorafenib at 400 milligrams daily or placebo. The patients were allowed to cross over to active therapy if they did progress on the placebo arm. And so there were about 90 patients that were presented in the results today, which were an interim analysis to check early results and looking for futility. And the results were truly overwhelming. So there was a dramatic improvement in progression-free survival at 6 months in particular with the the sorafenib-containing arm compared to placebo. And this actually was so impressive that the trial has been stopped because of the lack of ethics for patients to continue on the placebo arm with such outstanding results with the sorafenib. So this really does show that sorafenib is a reasonable therapy to use. However, what was interesting is that in the placebo-containing group, the response rate was still about 20%. Which means that some desmoid tumors will resolve on their own and actually get better even without therapy. And so for the right patients, for appropriate patients, we should still consider the watch and wait option as well as the sorafenib that's now a new option for treatment. So the last study I'll just briefly mention was a study of a drug called PECsiddhart for tenosynovial giant cell tumor, or what we call pigmented villonodular synovitis, or PVNS. So again, like the desmoids, these are not technically cancer, but they're locally aggressive overgrowths of the joint that grow based on an overexpression of a protein called CSF1. So PECsiddhart is a new drug that's designed to inhibit CSF1 production, and this was a randomized phase 3 trial, again enrolling patients with PVNS to either PECsiddhart or placebo for the first 24 weeks, followed by a crossover to the active drug-containing arm. And so the results that were presented were very impressive, with excellent response rates showing activity of PECsiddhart. Now, the only issue with this study was that there was some rare liver toxicity events, and so this has been a problem, including one episode, and not in this particular study, but of severe liver toxicity requiring a transplant in one case. So it will remain to be seen how quickly this drug will be brought to clinic. It may be that further safety evaluations and testing are necessary before the FDA will sign off on that. So those are the major trials that I think were the most exciting in sarcoma this year. You can tune in to many of the informational websites for additional information. Thank you.